From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Friday, February 19th. I'm Deborah Morgan. A bill sitting on Governor Cooper's desk requires schools to reopen 5 days a week. Leaders on both sides agree students can and should be back in the classroom, but the governor says the measure lawmakers passed this week falls short.
It allows them to put middle and high school students back in the classroom without social distancing. That's one problem that I have with the legislation that I told the legislature. And secondly, it hampers state and local officials from being able to respond to an emergency.
The governor says if a COVID variant gets worse in North Carolina, the legislation as written would still require students to be in school. He believes it ties the hands of state and local leaders to make real-time decisions. Supporters of the bill disagree. They point to the CDC data that indicates there's very little coronavirus spread among school children. The governor could veto the bill, or it could become law without his signature if he doesn't act in the next few days. In the race to get more vaccines in arms in North Carolina, the situation is improving, yet we are still behind what other states have achieved. WRAL data journalist Ingersoll looks into what states performing better than North Carolina did differently.
The line wrapped through Wake County's PNC Arena as hundreds of hopeful North Carolinians waited to see if they'd get a spot to get their COVID-19 shot. The state has administered more than 1 million first doses thus far.
We're the ninth largest state. We should be the ninth on the list for all the things if we're getting our doses out every week.
And the state is in the top 10 when it comes to total doses administered. But for the first doses given per capita, well, North Carolina falls short, coming in at 26 on the CDC's list.
We recognize the first few weeks of this, we did have vaccine on the shelf. We certainly sped up and got all of our first doses out. But now our second doses, you can't rush those. And so I do think over the next number of weeks, we'll catch up with in terms of getting all those second doses out. And then I think you'll see that kind of normalize, if you will.
So let's look at what other more successful states are doing differently than North Carolina. Looking to Alaska, which tops the list, it has the highest rate of veterans per capita, a large military presence, and more than 200 indigenous tribes. So health officials there said federal partnerships have allowed them to vaccinate people in those groups because they're allotted additional doses for the Departments of Veteran Affairs, Defense, and Indian Health Services. West Virginia is vaccinating between 15 to 20% more people per capita than North Carolina. Health officials in that state chose to forego partnering with Walgreens and CVS for any vaccine distribution, instead sending doses directly to smaller pharmacies, which are more prevalent in the largely rural state.
From the very beginning, would you have done anything differently?
The hard part about this is that you try to plan in advance, but we really didn't even know who this vaccine would be appropriate for. So we sort of had some planning, but the kind of depth of detail that we needed, we ultimately got in at the beginning of January. Do I wish we could have done that earlier? Yes, but I'm not really sure we could have.
There's this trickle-down effect that even if you iron out some of the kinks here or there, or, then there's still a bottleneck somewhere else.
More than 10% of the state's population has received at least one shot at this point. The state estimates it could be vaccinating at least 80,000 more people a week, but they aren't getting enough vaccine from the federal government to do so. While some states like Michigan, which has a larger administration rate, have announced targets wanting to vaccinate 70% of the state's eligible population by the end of the year, Cohen is hesitant to set such a goal.
It's really hard to create a target when we don't know the supply.
For the Coronavirus News Brief, I'm Deborah Morgan.